Sports are a thrilling display of athleticism and competition. From the cricket pitch to the football field, athletes push their limits, captivating fans worldwide. However, these physical feats come with inherent risks, and one of the most concerning injuries in sports today is the concussion. Concussions are not just a bump on the head, they are serious injuries that affect the brain and can have long-term consequences if not managed properly. Understanding concussions is crucial for athletes, coaches, and fans alike. It is vital to recognize the signs and symptoms, know how to respond immediately, and prioritize the long-term health of athletes over short-term gains. This essay will delve into the world of concussions, focusing on their occurrence in cricket and football, exploring the mechanisms, symptoms, and essential steps for prevention and treatment. Concussions occur when the brain experiences a sudden jolt or impact, causing it to move rapidly within the skull. This rapid movement can lead to the brain bouncing or twisting inside the skull, which can damage brain cells and create chemical changes in the brain. This movement can disrupt normal brain function and lead to a range of physical, cognitive, and emotional symptoms. These symptoms can include headaches, dizziness, confusion, memory loss, and even changes in mood or behavior. While concussions can result from a direct blow to the head, they can also occur from an impact to the body that transmits force to the head. This means that even if the head itself isn't directly hit, the force can still cause the brain to move within the skull. In cricket, a fast-moving ball can strike a batsman's helmet with tremendous force, potentially leading to a concussion. The speed and hardness of the ball make these impacts particularly dangerous. Similarly, a fielder diving to catch a ball and hitting their head on the ground can also sustain a concussion. The sudden impact with the ground can be enough to cause significant brain movement. Football, with its high-impact tackles and collisions, poses a significant risk of concussions. The nature of the sport involves frequent and often violent physical contact. A forceful tackle, especially involving helmet-to-helmet contact, can jolt the brain violently, increasing the likelihood of a concussion. These types of impacts are particularly concerning due to the direct force applied to the head. Even a seemingly routine play like heading the ball can contribute to concussions over time, particularly with repeated impacts. The cumulative effect of these smaller impacts can be just as harmful as a single, more severe blow. Understanding the specific mechanisms of concussions in these sports is crucial for developing effective prevention strategies and ensuring the well-being of athletes. By recognizing the risks and implementing proper safety measures, we can help protect players from the long-term effects of concussions. To truly grasp the seriousness of a concussion, it's important to understand what happens inside the brain when one occurs. Concussions are not just simple bumps on the head, they are complex injuries that can have significant impacts on brain function and overall health. Imagine the brain as a delicate organ floating in cerebrospinal fluid within the protective shell of the skull. This fluid serves as a cushion, absorbing minor shocks and movements. However, a forceful impact, such as a tackle or a ball strike, can cause the brain to collide with the skull's interior, leading to injury. This sudden movement can stretch and damage brain cells, disrupt chemical balances, and affect normal brain function. The brain's intricate network of neurons and synapses can be thrown into chaos. Think of it like shaking a snow globe vigorously. The snowflakes, representing brain cells, are thrown into disarray, disrupting the once clear view. This analogy helps illustrate the internal turmoil that occurs within the brain. These disruptions can manifest in a variety of ways, leading to the array of symptoms associated with concussions. Symptoms can include dizziness, confusion, headaches, and even memory loss. It's important to remember that every concussion is unique, and the severity of the injury can vary depending on the force of the impact, the individual's susceptibility, and other factors. No two concussions are exactly alike. While some concussions may resolve relatively quickly, others can have lingering effects that require extensive medical attention and rehabilitation. Recovery can be a long and challenging process, emphasizing the need for proper care and monitoring. Recognizing the symptoms of a concussion is crucial for ensuring prompt medical attention and preventing further injury. Concussions can occur in any sport or physical activity, making awareness essential for athletes, coaches, and even spectators. These symptoms can vary widely from person to person and may not always be immediately apparent. Sometimes the signs are subtle and can be easily overlooked, especially in the heat of the moment during a game. Some individuals may experience a loss of consciousness, although this is not as common as many people believe. It's a misconception that a concussion always involves being knocked out. More frequently, individuals who have sustained a concussion may report feeling dazed, confused, or disoriented. This can manifest as a general sense of being out of it, or not quite feeling right. They might have difficulty remembering recent events, concentrating, or following instructions. This cognitive impairment can affect their performance and decision-making on the field. Headaches, dizziness, and nausea are also common symptoms. These physical symptoms can be debilitating and may worsen with physical activity or movement. Visually, individuals may experience blurred vision, sensitivity to light, or see flashing lights. These visual disturbances can make it difficult to focus and can be particularly troubling in bright environments. It's important to remember that concussion symptoms can sometimes be delayed, appearing hours or even days after the initial injury. This delayed onset can make it challenging to connect the symptoms to the injury. Therefore, it's crucial to monitor anyone who has sustained a head injury closely for any unusual signs or behaviors. Continuous observation can help in identifying symptoms that might not be immediately obvious. Early recognition and proper management are key to minimizing the long-term impact of a concussion. Ensuring that the injured individual receives appropriate care can significantly improve their recovery and reduce the risk of complications.